Welcome to the Afterspin, opinions from thought leaders across North Carolina. Chris and John, the state treasurer, issued a news release last week going after the hospitals and healthcare systems across the state. Meanwhile, lawmakers were weighing in on executing the current contract for the state health plan. Let's start with Chris. What's the big fight here?
Well, the big fight is, I think, State Treasurer Dale Falwell is trying to reduce the cost of the state health plan, an admirable goal. The problem is the healthcare financing system, you know this is better than anybody, is incredibly complicated. You can't pick one piece out without affecting the whole thing. So you go after hospitals, you make it much harder for them to do things that they don't get compensated for. I think, I don't doubt Treasurer Falwell's motives, but it's a little, I wouldn't say grandstanding, but it's a little unfair to say, oh, he's going to reduce the cost of healthcare for everybody by going after the hospitals and getting more money. That might help in the short run, but the healthcare system is a giant whack-a-mole, and if you affect it one place, it's going to affect people on the other end, and we don't know who yet.
John, healthcare providers, the hospitals and doctors say they don't make money on Medicare and Medicaid, and if the private insurance sector doesn't pay higher rates than the federal government and the state government, then it threatens the financial welfare of a healthcare delivery system. What say you?
I say that if you hear that from a struggling rural hospital that barely makes ends meet, you ought to pay some attention to it. If you hear it from other hospital systems that make large amounts of money, you ought to treat it as pretty suspicious, the claims they make, and that's properly the right way you should think about it. First of all, there's a difference between average and marginal cost. Once you've got your fixed costs paid for, of course they make money on some of their Medicare and Medicaid patients. That's just reality. I hope they're not denying that. If everybody was a Medicare and Medicaid patient, that would be a different story. But that's not what we're talking about. We're talking about changes in reimbursement rates for a large chunk of business for most health providers. At the very least, the hospital bills and the billing systems are so absurdly obscure and opaque that there shouldn't be any debate about that. And the fact the hospitals won't change that should tell you something. They want it to be obscure. They want it to be opaque. That's a bad sign. Keep digging, Treasurer Falwell.
The Blue Cross Blue Shield of North Carolina manages the state health plan.
Yes.
They have the same rates for the state health plan that they do for private insurers. So is the treasurer not able to see those rates?
It's what is being done in different providers for different services and different costs. That's what they can't get a hold of. And it's the Blue Cross role in this controversy is very interesting because the hospitals at one point claimed that Blue Cross was against what the treasurer was proposing. I do not believe that is the case. I don't think they're actively lobbying it. So I think this is a difficult issue. I don't think that ultimately the State Employees Association that is backing up the treasurer, I don't think that everything they want will happen, but I think the hospitals are fooling themselves if they believe it is a sensible long-term plan to just get a few lawmakers that support their agenda to pass a bill to kick the ball down the field another year or two. This is going to come to a head at some point, not just in North Carolina, but around the country. And when hospitals and doctors say, we lose money, and the providers say, what do you mean you mean you wouldn't do the job for 10% less money? I mean, in other words, they're not just price takers, they are price makers. They decide how much they're going to get paid. And if the notion is they're all going to leave the medical industry, all the doctors are going to stop taking patients, I don't believe that.
Chris, the state treasurer says he wants to reduce the amount about $300 million to cut the cost in the state health plan. That's a lot of money. Will he be able to get it done?
I think he'll reduce it some, but again, I mean, I'd love for it to be reduced by $1 billion or $500 million, but where does that money come from? What happens to those hospitals? There are struggling rural hospitals. It's interesting, we're talking about this in the wake of, was it 6 months or a year ago, the Asheville Hospital and Blue Cross had a terrible fight about how much they were going to get paid. This is very complicated. The danger, as I said previously, is when you pick one piece out, in this case, the hospital charges. It's a giant healthcare system. We have to look at this holistically. Nobody's willing to do that because, understandably, everybody has a piece they're trying to protect, including the treasurer.
Thank you for watching the Afterspin. More video all during the week on ncspin.com.